Hi, everyone. Just going to get going with the Ontario numbers. 1,058 is the increase, so it's kind of been stable at those numbers now, at least 4 or 5 days. The deaths went up by 11. Again, most are in the GTA area. Ottawa had 51. In our area, the numbers are actually looking pretty good. I'm just going to go to it now. Yeah, we added, I think, 12 over this past weekend. I'm just going to share my screen with you here. Share. So we added 12 cases over the weekend. Again, 8 in Prescott-Russell, 2 in Cornwall, and 2 in SDNG. We're now a total of 106 active cases, a total of over 2,700 cases. Good news is we only have 3 hospitalized patients and none in the ICU. We added 1 death. That was a death in Akwesasne. We have no other details of that, but that was the extra death that was added tragically over the weekend, I think on Friday. In terms of number of vaccines, we're up to 5,000 vaccines, and more than that actually, because we're adding some from today. But I'll keep you posted on that a bit later. I'll just give you an update in terms of the numbers. Again, the numbers are going down, and we can see very clearly now that we're now clearly entrenched in the literally all of our health. We're really at the border now between yellow and orange. And last week, the ministry kept us in orange. And we'll see where we're going to be this week. It's going to be reevaluated based on, again, our numbers and our trends. But you could see we've been holding steady now for a good 10 days, 10, 12 days below the red line. And then clearly in the orange here, over the last couple of days, having steady. So that is, I think, good news in terms of where we are with our numbers. And again, so far we're so good. We have not had any VOCs in our area, variants of concern in our area. But as I said, I keep saying it's only a matter of time. I know that we have there's several in Ottawa, and the numbers are increasing across the province. So that's to me another major preoccupation, but I think we're doing okay. It's going to be a week tomorrow since we entered the orange zone, and I think that that will be just let's continue going with those numbers. Now, in terms of vaccinations, I'll spend most of the time talking about vaccinations, but before I do that, hold on. In terms of long-term care, again, the numbers are down in terms of the long-term care facilities. There's no new ones. Woodland Villa is still under outbreak. There's 13 active out of the 48 residents that were positive, and there's 6 active out of the 16 staff that were positive. Testing was completed on the 20th and 21st. We're getting results there again. We're continuing. That seems to be stable. Riverview Manor seems to be stable as well. The remainder of them really are 0 or no residents. Actually, the remainder are actually no residents. They're all positive staff on routine screening. So that's where we are with that. So I want to go talk about vaccines. And over the weekend, since Friday, our staff, in partnership with our EMS partners, have done an incredible job. They actually went and vaccinated residents and/or staff in 22 facilities, retirement homes and long-term care. They're all on our website, and they administer over 800 vaccines over the weekend, which is unbelievable, which is great. And they're continuing. We have 14 out of the 36 retirement homes left to visit. And by that time, when we do the 14, we'll have done the first dose of all the congregate senior living. And we continue to provide our hospitals with vaccine. And we will be in a position very shortly to start with the 80 and over individuals for vaccination. Again, the phases are being worked out right now. We're actually again going to be we're going to be communicating. There's like I said on our website now, we have a bit of a mapping out on our website. We have a press release that's coming again, just to sort of summarize where you can get information. At this point, we're at the stage where we're planning our next public sort of facing would be with the 80 and over, and that's what we're working on right now. getting information, trying to find out which 80-year-olds are outside of the long-term care and retirement home. Because don't forget, we're through the 36 retirement homes, and the 18 long-term care facilities that we have. There's a significant proportion of people that live there that are over 80. So we're now getting the numbers to just and identify individuals that require that. And moving forward for phase 2, which then will ramp up towards the end of March for looking at other age groups, moving it on to essential workers and so on. There's a lot of work being done right now with the ministry. I attended a meeting today looking at some of the priorities. They're not out yet, but it's going to be following exactly what we had talked about in terms of the phase 1 and phase 2. Phase 2 starting towards March, middle March to the end of March, where we'll be expecting to have more vaccine for us. So I think that it's very good. We, as a matter of fact, today we received our trays of vaccine, 4 trays of vaccine of Pfizer. We have requested for some Moderna because as we are going to do home care, don't forget we're also going to be vaccinating home care, and that's one at a time. The Pfizer vaccine itself has limitations. Once we take it out of the freezer and move it to one place, we can't move it again. So and each vial has 6 doses, as you know, and we're getting 6 doses by most of the time, actually, which is good. They're becoming experts, our nurses and our drawers. But when we start vaccinating individuals in homes, the Pfizer vaccine, it is not going to be useful because we're going to be wasting a vial. Once we go in and open the vial and use it there in one individual's home, we won't be able to use it anymore. So to us, it's important. So we will be looking at other vaccines for that as well. But like I said, those are the logistics that we're dealing with. Our teams are working with municipalities and other partners, have identified multiple sites for this. As of this week, we're also going to be vaccinating healthcare workers and staff that we missed or need a second dose in our retirement long-term care homes, and that'll be done in a variety of offices across our area, at least 6 sites across our area. And so as we move forward, we will be releasing more of those details. Donc, bonjour tout le monde. On va commencer avec les chiffres ontariennes. On est rendu à 2094 cas en Ontario, 294 000 cas en Ontario, avec 1058 cas de plus ajoutés aujourd'hui. Ceci est un chiffre stable depuis à peu près 5-6 jours. Donc, on voit toujours que la plupart des cas sont à Toronto, autour de Toronto. Chez nous, dans nos bureaux de santé, on a ajouté vraiment peu de cas, ce qui est de bonne nouvelle ce fin de semaine. En effet, nous avons ajouté un total de 12 cas depuis vendredi. Donc, 2 à Cornwall, 2 à SDNG, 8 à Prescott-Russell. Faut dire aussi qu'on voit les flambées sont en diminuant. On a juste 3 à l'hôpital. Il y a à peu près 2 semaines, on avait plus que 25 à l'hôpital, donc ça, c'est de bonnes nouvelles. Aucune patiente aux soins intensifs. Nous avons ajouté un décès pendant la fin de semaine. C'était un décès d'une résidente à Aquasasni, tragiquement encore. Et nous avons vacciné jusqu'à date 5 252. La compte augmente. Je vais en parler tantôt au niveau du vaccin. Au niveau des moyens mobiles que nous avons, vous voyez ici que vraiment, on est clairement ici nettement dans la zone orange et on approche le jaune. Vous voyez, ça fait quelques jours qu'on est stable ici. Donc, ça c'est notre ligne ici qui est foncé orange. Donc, si on suit le foncé orange, bureau de santé, on se trouve à 22, qui est vraiment en jaune. Mais SDNG est à 25, qui est en orange. Donc, on est pas mal proche de jaune. La semaine passée, le ministère, nous avons laissé dans la zone orange, mais ceci peut-être va changer cette semaine. Mais moi, je dis toujours de ne prendre pas de chance, de vraiment, étant donné que nous avons la menace des variantes, que jusqu'à date, on a peu dans notre région, mais on a eu à travers l'Ontario, on voit les chiffres augmentant de façon, à mon avis, inquiétante. Mais comme je dis, on n'a pas dans notre région jusqu'à date, mais ça ne me surprendra pas qu'on aurait des cas dans notre région, comme on voit à travers l'Ontario. Donc, au niveau des vaccins, on a des bonnes nouvelles. Nous avons reçu les 4 traits ce matin de Pfizer. Le fin de semaine, nous avons visité 22 établissements, des maisons de retraite et des maisons de longue durée, soit la première ou deuxième dose, dépendamment où on était. On a administré plus que 800 vaccins. Là, on est rendu à 5000 quelques vaccins vaccinés, mais je pense que ça va augmenter. Euh, il reste 14 sur 36 maisons de retraite à faire. Une fois qu'on finit avec la première dose, on procéderait d'aller vacciner, de continuer à vacciner bien sûr les travailleurs de la santé, surtout dans les hôpitaux qui sont en haut risque. Et aussi, on va vacciner les personnes plus que 80 ans et aussi les personnes qui reçoivent les soins à la domicile. Euh, en effet, au niveau des personnes des personnes âgées 80 et plus, nous avons une indication, nous avons à peu près 9000 dans notre région, mais la plupart, on a un bon pourcentage que déjà nous avons vacciné dans les maisons de retraite ou dans les maisons de longue durée. Donc, je dis 18 maisons de longue durée et 35, 36 au niveau de maisons de retraite. Donc, nous avons pas mal là, mais les restants, on va les vacciner. On va avoir des cliniques, des cliniques. On va aussi parler avec le partenaire municipal, etc., avec lesquels on part déjà pour trouver les espaces pour les cliniques de masse immunisation dans l'avenir. Pour le moment, nos mandat est vraiment de finir avec les personnes qui travaillent aux hôpitaux et tout le personnel et les résidents dans les maisons de retraite et dans les maisons de longue durée. Donc, on a une bonne part. Je pense que d'ici quelques semaines, peut-être la semaine prochaine, on va commencer les personnes âgées 80 et plus. Et il faut dire aussi qu'on va continuer à vacciner les personnes parce que n'oubliez pas qu'on a rentré des fois 2 fois dans les maisons de foyer ou dans les foyers de longue durée ou les maisons de retraite. Et des fois, on a manqué parce que la priorité était de vacciner les résidents. Donc, parmi plusieurs, je peux dire la plupart, on n'a pas vacciné soit la première ou même la deuxième dose dans des cas au niveau des employés et des visiteurs. Donc, pour ça, nous allons établir dès de cette semaine des cliniques autour de tous nos bureaux de santé. On a 6 à travers de nos bureaux de santé des locaux à travers dans notre région, dans laquelle on va prendre rendez-vous pour vacciner ces gens-là. Au niveau des prochaines étapes, bien sûr, on est en train de voir qu'est-ce qu'il va y avoir la deuxième phase. On va continuer tel qu'entendu. On va commencer avec les âges, à un moment donné, 75, etc., plus que 75, plus que 60, dans des tranches de 5 ans. On va commencer, bien sûr, avec de vacciner les travailleurs essentiels, premiers répondeurs, etc. Tout ça est en marche. On a des plans. Nous avons mis sur nos sites web une schématique aussi avec les informations, avec les priorités. Et plus on aura l'information, plus qu'on va mettre sur nos sites web pour sensibiliser les gens et tout le monde pour qu'ils puissent savoir où on est rendu. En effet, on a les plans vraiment de augmenter le débit de vaccins probablement d'ici fin mars. À ce moment-là, on aura beaucoup plus de débit selon ce que le ministère nous dit. N'oubliez pas que toutes les planifications, ça se fait autour de la pensée qu'on a 2 vaccins seulement. Je suis pas mal sûr qu'on aurait un troisième bientôt, donc tout ça va changer. Et à ce moment-là, on va réagir. Donc, il y a là sur nos sites web, vous allez voir, on a une schématique, on a pas mal les façons à vacciner, les cliniques masse, etc. Et aussi, même les cliniques volantes aussi. Donc, on a une panoplie de différents moyennes qu'on pourrait vacciner les gens. Notre but vraiment est de faire la plupart, de le faire le plus vite possible. Et la limite, ce n'est pas nos volontés, nos capacités. La limite, c'est plutôt le vaccin. On aurait besoin de le vaccin, mais ça, ceci va changer bientôt quand Ontario va recevoir des millions des doses. So I'm just going to answer some questions that I've got here, and then we'll go to the media. Has a vaccine supply been arriving as expected? Yes, as a matter of fact, we got our vaccine supply this week, which is good news, and we're expecting another delivery next week. The timeline for vaccination has not changed at this point. We're still moving forward to vaccinate the elderly and home care starting within the next 7 to 10 days. As soon as we finish off the retirement homes first dosage, we got 14 left, and we should be able to start with the other ones in that regard. I had a question here. I don't have the full answers. Does the EOHU have stats on the number of people currently in self-isolation? Yes, we do, Nelson. Haven't had time to look at the whole list, but I can tell you that because you asked me how many are in self-isolation for each person test positive. It ranges from 0 to 31. I'll ask my EPI department to just do the calculations. And maximum number of people in self-isolation, 31. There you go. So that's the answer there. Donc, je vais prendre des questions, Jenna.
Thank you. Merci, Dr. Paul. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Good afternoon, Dr. Paul. I've got 2 questions here. The first one is about the outbreak at Woodland Villa and the new outbreak at Glen Stordon Lodge. Yep. You said the numbers of residents that were still active and the staff that were still active at Woodland. Yep. How many deaths total are there?
6.
Okay. And then associated with that is the new outbreak that happened. Is that just staff at?
One staff, no residents at Glen Stordon Lodge.
Okay. Is that because the vaccinations had to be changed where the staff weren't getting the vaccinations, just the residents?
No, I don't know what the story is on this one. No.
Okay.
I don't think it's related.
My second question is, this morning an alert went out that there was a case at Seaway District High School associated with the school. Didn't say if it was staff or student. But of course, the letter went out to all the parents, and then the board issued a release. But it doesn't specify whether that person's a remote learner or a remote staff member, because they're still associated with the board, even if they're not in the school. How many instances has it happened where there's been a remote worker or a student that's triggered this type of an alert? And do you think that the reporting should change to say whether or not it's a remote person or not? Because they're still counted as remote as part of the school, whether they're remote or not.
I can tell you when I report them to you, I do not count the remote ones, and I do not count the ones that were never in school. So okay. I agree with you.
Okay.
Okay.
Thank you.
Our next question comes from Nelson Zandbergen, Nation Valley News. Please go ahead.
Sorry about that. Hi, Doctor.
Hi.
I was wondering where the long-term care employees, where do they fit in the queue at this point? Because I understand that some of them have not yet received the vaccine.
Long-term care employees, yes. That's what I was saying, Nelson. It's a good question. Essentially, what we're doing is because of we had to pivot, if you recall, around the end of January because we didn't have enough supply. Initially, probably in about 6 or 7 homes, we vaccinated long-term care employees. But then moving forward, we were told just to vaccinate residents because we didn't have enough vaccine. So we did the whole round of those homes, the long-term care, and then we started doing retirement homes. So now what's happening is as we go back, we catch up and we're giving second doses to the retirement, to the long-term care. We're catching we're getting the employees there, but obviously they're going to miss a dose and we're not going to go back because we've already done the residents second time. So now we have, as I said before, that's why we created special clinics for them to be able to come. We have six clinics throughout the East Ontario Health Unit area where they can come, make an appointment and get vaccinated.
Okay. Also group homes and those employees, where do they fit into the queue at this point?
Group homes as well. They're congregate living sessions. They're actually in the early phase 2.
Okay. Thank you, Doctor.
No problem.
Next questions come from Thomas Stockton, TVC 22. Though the details for the public rollout are still to come, can you let us know what plans are in place to get the vaccines out to people who, through age or due to disabilities, cannot leave their homes?
Yes, the plans are basically we're working for home care. We're identifying them. We're working with the social service agencies, home care, to be able to identify them and provide on-site. We will deliver it to their homes, and the same thing for elderly. And there'll be messaging in that regard, particularly for the elderly who are not mobile, so we can identify them and send our staff to vaccinate in their homes.
Last week, you were urging caution when it came to the zones. With our current numbers, will you suggest to keep the region in orange, even if there is a suggestion to move to yellow?
That's a good question. I got to reevaluate the numbers. I want to see where we are with VOCs across the province and see what goes on there. We will be having that discussion on Wednesday.
And what is in place to detect VOCs in the region?
There, right now, every positive test goes through a screen, and that screen picks up a mutation, and then we're notified. Then that mutation, that sample is sent to the lab in Toronto, and they do the genomic sequence to see exactly which one it is. Is it the UK or South African or Brazilian one? So we would know when they do a positive test. They then take all those and then do that screen for the general mutation, which picks up any of the three that we have, but it doesn't give us specifics. And then that takes about a week. So they give us an alert when the screen is positive. So far, we haven't got anything yet, but like I said, I wouldn't be surprised if we would shortly.
Thank you. Prochaine question, Ismaël Si, Radio-Canada. C'est à vous.
Bonjour, Dr. Paul.
Bonjour.
Depuis aujourd'hui, partout en province, les élèves, que ce soit du primaire ou du secondaire, qui ont un seul symptôme de la COVID, doivent rester à la maison et ne peuvent pas retourner à moins que ça fasse 10 jours qu'ils ont reçu un test négatif. Qu'est-ce que vous pensez de cette mesure-là? Puis est-ce que vous pensez que ça va aider à prévenir les foyers d'éclosion dans les écoles?
En effet, nous avons retourné à ce modèle. Vous savez qu'en mois de septembre, on avait commencé avec un symptôme unique et nous avons reculé. On a dit 2 parce qu'on trouvait beaucoup des enfants qui avaient un nez qui coulait pour d'autres choses, étaient forcés de rester chez eux et avec les parents. Je pense la raison pour laquelle on a reculé, on a retourné à un symptôme, c'est parce que nous voudrons avoir une prudence surplus, beaucoup plus de prudence cette fois-ci à cause de peur qu'on ne veut pas manquer les variantes. C'est pour ça qu'on le fait. Et je comprends bien qu'avec un symptôme, les enfants doivent rester à la maison et les parents aussi, jusqu'à temps que l'enfant soit testé. Chose qui est différente cette fois-ci, c'est qu'on va être capable d'offrir les tests instantanés, si vous voulez, dans nos 6 centres de dépistage à travers de notre région pour qu'on puisse avoir les résultats le plus vite possible pour qu'on puisse avoir une décision oui ou non. Si c'est positif, en ce moment-là, c'est un cas positif. Si c'est négatif, à ce moment-là, l'enfant pourrait retourner à l'école.
Merci beaucoup.
Pas de problème.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Seems as though those are all the questions for today, Dr. Paul.
Thank you. Merci tout le monde.